Hello, I'm Sharon Morgan from TameMyPain.com. I'm a psychologist with a special interest in the management of chronic pain. I've made a short video talking about something called the boom-bust cycle. It's a very common problem that people with chronic pain experience, and understanding how it works may make a big difference to the quality of your life. Let me ask you this. Do you assume that doing less physical activity is a helpful strategy to keep you safe and minimise your pain? The truth may surprise you. Sometimes referred to as the cycle of over and under activity, being trapped in this way can lead to a very restricted lifestyle, low self-esteem and depression. So what exactly is the trap? Simply put, the cycle works like this. When you're having a good day, that is, your pain rating is low, you're more likely to try to get as many things done as you possibly can. This might include things like household chores, driving, going to work, playing with the kids and gardening for extended periods of time. On these days you feel great. It's like you're back to your old self again and you're doing the things that used to give you pleasure or a sense of purpose in your day. However, it comes at a real cost, and usually over the next day or so, you really suffer for it. Now, why does this happen? Well, because of your previous inactivity due to pain, a lack of fitness can lead to your muscles being easily strained, resulting in a worsening of your pain over the next few days. So, to avoid making your pain worse, you rest again and become even more unfit. You begin to realise that with each and every episode of increased pain, you become very tempted to avoid activities that may result in more pain. If this cycle continues, then less and less activity is needed to overdo things. The bottom line here is that you may end up experiencing higher pain ratings and achieving much less in your day, and this frequently leads to feelings of frustration, failure, and anger. So if doing less isn't really improving things for you, how can you do more and not suffer for it days later? Well, there are a couple of ways to achieve this. The first is to engage in a carefully tailored exercise plan that builds up muscle, reverses the effects of inactivity on your body, and aims to reduce the limitations you currently struggle with physically. A rehabilitation coordinator or some qualified personal trainers can design this program specifically for you. One of the special techniques we use as psychologists is called pacing. It's the simplest and most effective way to avoid the boom-bust trap and safely increase your levels of daily activity. We use a simple, straightforward process to determine a safe starting point or baseline to even out your activity levels. This ensures that even on bad days, you can confidently engage in normal daily living without the fear of re-injury. So, if you'd like to learn more about how to pace yourself, then all the information you need can be found in my ebook designed specifically for chronic pain sufferers. If, like my client, you'd like to try a non-drug approach that can help you to do more and hurt less, then the Tame My Pain ebook will help you to start living the life you want. Take care of yourself.